This video is not intended to cause you panic and anxiety. This video is just for the purpose of COVID-19 drug development until today, updated May 9, 2020. Is there any specific treatment or antiviral drugs for COVID-19 right now? The fact is, currently there is no specific antiviral treatment for COVID-19. Scientists, several drug companies and medical institutions around the world are working on potential treatments for the new coronavirus disease known as COVID-19. They are working hard on antiviral drugs, some of which are already in use against other illnesses, to treat people who already have COVID-19. What are antiviral drugs? Antiviral drugs are prescription medicines, pills, liquid, an inhaled powder, or an intravenous solution that fight against flu viruses in your body. Antiviral drugs are not sold over the counter or pharmacy. You can only get them if you have a prescription from a healthcare provider. Antiviral treatment works best when started soon after flu illness begins. When treatment is started within 2 days of becoming sick with flu symptoms, antiviral drugs can lessen fever and flu symptoms, and shorten the time you are sick by about 1 day. Antiviral also may reduce the risk of complications such as respiratory complications and severe illness caused by a particular virus. For people at high risk of serious flu complications, early treatment with an antiviral drug can mean having milder illness instead of more severe illness that might require a hospital stay. World Health Organization (WHO) has launched a large global clinical trial called Solidarity Trial. The Solidarity Trial will compare 4 treatment options to assess their relative effectiveness against COVID-19. By enrolling patients in multiple countries, the Solidarity Trial aims to rapidly discover whether any of the drugs slow disease progression or improve survival. Other drugs can be added based on emerging evidence. Until there is sufficient evidence, WHO cautions against physicians and medical associations recommending or administering these unproven treatments to patients with COVID-19. In March, the WHO initiated the Solidarity Trial in 10 countries. As of the 21st of April, over 100 countries were participating in the Solidarity Trial. This trial will attempt to find out if the combinations of these promising old and new drugs can treat COVID-19. 1. Chloroquine or hydroxychloroquine. 2. Remdesivir. 3. Lopinavir with ritonavir. 4. Lopinavir with ritonavir plus interferon beta-1a. What is hydroxychloroquine? Hydroxychloroquine (HCQ) is an antimalarial drug and also used in treating autoimmune diseases. Its antiviral activity was demonstrated in restricting HIV infection in vitro. In addition to several antiviral agents, antimalarial drugs have been proposed as treatments that could reduce transmission of the virus. In vitro studies have shown that chloroquine and hydroxychloroquine can both inhibit SARS-CoV-2 transmission. Early results from clinical studies conducted in China suggest that chloroquine use might have been associated with reduced fever, increased resolution of lung lesions on CT, and delayed disease progression. On the basis of these preliminary findings, chloroquine and hydroxychloroquine have been prescribed to patients to reduce the length of hospital stay and improve the evolution of COVID-19-related pneumonia. Nevertheless, the recently published Surviving Sepsis Campaign Guidelines on the Management of Critically Ill Patients with COVID-19 concluded that there was insufficient evidence to offer any recommendation on the routine use of these drugs in patients admitted to the Intensive Care Unit (ICU). What is antiviral remdesivir? Remdesivir is an antiviral drug originally developed to fight the Ebola and Marburg viruses. It inhibits a key RNA ribonucleic acid enzyme in a virus and shuts down its replication. Remdesivir was not that effective in treating Ebola, compared to other therapies, but studies have shown that it can inhibit the coronaviruses that cause SARS, severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome. Therefore, the very first COVID-19 patient diagnosed in the United States was given remdesivir when he got very ill, simply because they had to test it out. He improved the next day. They then tried it on a very sick Californian COVID-19 patient, and he also improved. This led the American scientists to believe that of all the potential drugs, remdesivir is the most promising for the treatment of COVID-19. Unlike chloroquine, remdesivir can be given in high doses without toxicity. What is antiviral ritonavir? Ritonavir is an antiretroviral medication. It is classed under protease inhibitors. It is used to inhibit the enzyme that metabolizes other protease inhibitors, allowing them to work longer in the body. It is one of the medicines used in the very effective highly active antiretroviral therapy regimen used to treat HIV/AIDS. A low dose of ritonavir is used with other protease inhibitors in the regimen. It can also be used in combination with other medicines to treat hepatitis C. Its side effects include nausea, loss of appetite, diarrhea, and numbness. It can also have serious side effects that affect the liver, pancreas, and heart rhythm. What is antiviral lopinavir? Lopinavir is also a protease inhibitor. It is usually used with ritonavir. It is because ritonavir strongly inhibits the metabolism of lopinavir, allowing lopinavir to work longer in the body. It was patented in 1995 and came into use around 2000. Somehow, a Wuhan study this year, 2020, found that the ritonavir-lopinavir combination was not effective in combating COVID-19. However, the Solidarity trial will still study it to confirm or disprove the Wuhan results. What is antiviral interferon? Interferon is a cytokine that is produced by our own bodies as part of the immune response against an invading virus or bacteria. It is produced at the end of an attack, and helps the body reduce its own immune reaction and the severity of the inflammation caused. Call it a modulator if you will. It is currently used to treat multiple sclerosis. As some COVID-19 patients have a cytokine storm that causes their lungs to fill with fluid, requiring them to be ventilated, a drug like interferon beta can help to calm this storm and prevent the need for ventilation. Well, thank you for watching my video regarding drugs development for COVID-19. In my next video, I will compile and clarify the antiviral that has been approved by several government administrations as an option to treating COVID-19 patients in their nation. Gaining knowledge is the first step to wisdom. Sharing it is the first step to humanity. Thank you so much for your like and subscribe. Till we meet again. Stay safe. Stay cool. #stay home and check out my next video.